How to check heart on X-rays. Checking the heart on a chest X-ray involves measuring the cardiothoracic ratio, CTR, checking the cardiac silhouette shape, and assessing for signs of fluid or congestion. In this lecture, we will learn how to measure size of the heart. This is done by measuring the cardiothoracic ratio of the heart. The cardiothoracic ratio is a quick measurement used by doctors to estimate if a person's heart is an abnormal size. It compares the horizontal width of the heart shadow to the maximum width of the inner chest cage on a standard chest X-ray. Let's discuss this in details. Cardiomegaly on a chest X-ray is calculated using the cardiothoracic ratio. This is done by measuring the maximum horizontal width of the heart and dividing it by the maximum horizontal inner width of the chest cavity on an erect postero-anterior X-ray view. A ratio greater than 0.50, 50%, indicates cardiomegaly. Following are the steps to measure the cardiothoracic ratio on X-rays. Step 1. Use a PA film. Ensure the X-ray is a postero-anterior view, back-to-front beam, because an A-P view, front to back, magnifies the heart size. Step 2. Find cardiac width. First, draw a vertical line down the center of the chest. Then measure the widest horizontal distance from the midline to the right heart border. We will mark it as A. And we will add it to the widest distance from the midline to the outer edge of the left heart border, which will be B. Step 3. Find thoracic width. Measure the maximum horizontal internal width of the chest cavity from the inner surface of the right rib to the inner surface of the left rib at the level of the diaphragm. Step 4. Apply the formula. Now divide the total cardiac width, which you measured in Step 2, by the thoracic width, which you measured in Step 3. It is important to note that it does not matter which unit of measurement you use, because you divide the heart width by the chest width. The units cancel out completely, making the final cardiothoracic ratio a pure percentage. Normal threshold of cardiothoracic ratio. A normal cardiothoracic ratio is 0.50 or less, 50%, in healthy adults. Enlargement threshold. A ratio greater than 0.50 indicates cardiomegaly, an enlarged heart. Infant exception. Infants naturally have larger hearts relative to their chest. A ratio up to 0.60 can be normal for them.